Yeah, well, first of all, you can't protocol. It's not protocol. It has to be individualized evaluation, find out what deficits they have and address those deficits. So when you first and foremost, the number one thing you have to fix after a concussion is sleep. You have to. If you don't fix sleep, you're not going to fix anything. So you fix the sleep first. You talk about nutrition. What's proper nutrition to actually feed the brain? The brain doesn't store any glucose. So therefore, you have to feed it consistently so those systems have what they need to heal and to work better. Then after that, it's determining what deficits you get from the concussion, from the concussion mechanism. Do you have an ocular motor issue? Do you have a vestibular issue? Do you have a cognitive issue? Do you have a migraine type issue? Do you have a cervogenic issue? What is actually injured? Treat that, or even before you start to treat that, is know how to teach the patient not to exacerbate that. So you teach them that. Then you start treating that. And you also treat areas that you don't have deficits. Because if you don't have a vestibular issue, or your tests aren't sensitive enough to determine they have a vestibular issue, you should still work the vestibular system, because if you have an ocular motor system, those systems work together, don't they? They also work with the cognitive portion of the brain. So you should work that. So you need to work all those areas in combinations. The analogy of if you have a knee injury, you don't just treat the knee, you take care of the hip and the ankle at the same time. So why don't you work the brain that way? Well, the answer is you should. And you should be doing that from basically day two on. Because if you stimulate one area to develop and to work, doesn't that help promote healing of another area? We do it in every other body part. Why wouldn't we do that in the brain?